Thanks everyone for joining us for our advocacy grand rounds. I'm going to give a little intro to Doctors for America and intro our speakers, and then I'll have Dee Dee kind of moderate our question and answer session. So before we get started, I want to invite you to officially join Doctors for America. Being a member means taking the important and simple step of selecting a membership level and paying your annual membership dues to support Doctors for America's organizational sustainability and incredible programs like the Advocacy Grand Round series. There's 4 different levels to choose from, and a DFA member will put the link to join in the chat right now. We're going to make a recording of this, and the materials will be available afterwards if you want to re-watch or look something up. And some ground rules for the session is that there's no such thing as a stupid question, and we welcome questions, so you can use the Q&A feature, and we're also going to have kind of like an open Q&A at the end as well, and we'll address the questions during the end of the session. So as we were thinking about what we wanted to do for this grand rounds, we were thinking that more often than not, when we had our community health and prevention meetings, there was a collective as we sent each other the newest news article from that week. And so we were hoping that this session could be an opportunity to hear from some advocacy experts about staying focused and motivated to work for issues that are important, even when the work is slow or it's not a success. And so I'll start by introducing our speakers. Our first speaker is Dr. Judith Feinberg, who's a professor of both medicine and infectious diseases and behavioral medicine and psychiatry at the West Virginia University School of Medicine. After a career in HIV and AIDS research, she was recruited to WVU in 2015 to develop a research program focusing on the intersection of injection drug use epidemic and its associated medical and infectious complications. Dr. Feinberg has been the chair of the national boards of both the HIV Medicine Association and the American Academy of HIV Medicine. She has been funded by multiple federal, state, and industry grants for studies in the management of substance use disorder and the complications of injection drug use, with a particular focus on hepatitis C and HIV. Dr. Feinberg is committed to turning the tide on these diseases that are devastating West Virginia. Our second speaker is Dr. Todd Otten. He's a husband, father, family physician, and decorated naval flight surgeon. He has over 20 years of experience in providing quality patient care, leading teams, and managing projects in various settings, including the United States Navy, where he was honored as the Naval Flight Surgeon of the Year in 2006 for the Atlantic Fleet. He recently joined Plum Health Direct Primary Care in Lansing, Michigan, and he's co-founder of Our Quadruple Aim, a movement that challenges the status quo in healthcare and promotes patient safety, quality care, lower costs, and provider wellness. He's also co-author of Ripple of Change, a book that offers a bare-bones approach to evaluate, reimagine, and inspire positive disruption in the healthcare industry and beyond. He's passionate about empowering patients and healthcare providers to become agents of change and to turn their ripples into waves of lasting impact. And so with that, I will hand it over to Dee Dee, who is our Doctors for America Capella Fellow in Health Advocacy for the Public Health Task Force, who's going to lead the Q&A session.
Great. Thanks so much. And welcome, Dr. Otten and Dr. Feinberg. Maybe do you want to just start with a couple opening words on your thoughts on resilience and resistance, which is the topic of our conversation today? Maybe Dr. Feinberg, you can start.
Well, yeah. I mean, I think here's the deal. From my own experience, it's pretty rare when things that you want to accomplish happen the first time out. It's pretty rare. It's wonderful, but it's pretty unusual. And sometimes you just have to keep plugging away at something again and again and again. And sometimes what happens is you make incremental progress, and that's good. A lot of what chipping away at things means is that you are garnering new advocates, supporters, allies. You have to keep looking for these people. They're out there, or you can, convince them that this is something important that you think they ought to be involved in. And while you're working on getting the changes that you want to see, you're really building a movement, you're building an organization, and that definitely doesn't happen overnight. So I'll give you instead of just talking in generalities, I'll give you some specifics. So when what I call the 21st century opioid epidemic which was really anchored in Central Appalachia. And just for those of you who are geographically challenged, what's Central Appalachia? It's Southern Ohio, Eastern Kentucky, all of West Virginia, Southwestern Virginia, Northeastern Tennessee, if you can picture that in your mind. And I was at the University of Cincinnati, which borders the westernmost reach of Central Appalachia and Southern Ohio, and started seeing patients that had the classic infectious complications of injection drug use. So Cincinnati had never been part of the 20th century opioid epidemic, which was really a heroin thing. Like that was Detroit and Cleveland. Cleveland's the opposite end of the state from Cincinnati, right? It's in the northeast corner. Cincinnati's in the southwest corner. Cincinnati's so far south, our airport's in Kentucky. Okay, it's hard because all the big cities in Ohio begin with a C, and until I moved there, I was confused about it too. But Cleveland's like on a Great Lake and gets like 25 feet of snow a year, and Cincinnati is like borders the South. So I knew that from my time in Baltimore, that if we didn't organize around syringe exchange, everyone would get these horrible infections. They'd get HIV and hepatitis B and hepatitis C, and they'd die from overdose. And so I started working, and this was in 2005, I started working on how was I going to get this to happen. And it didn't happen till 2014. So it was like 8 long years, because I really got going at the beginning of 2006. So it's like 8 long years of organizing, talking to people, having community meetings, having meetings with health departments. And it was, it's easy to get discouraged when things don't go the way because of public health necessity, the way you want to see them go. But, if you don't keep chipping at it, you don't get there. And as I said, it's really rare to be successful on your maiden trip, out the door to get something done. And in the end, we really did wind up with really good allies and supporters. We got a major health foundation in Cincinnati to back us. In fact, they gave us a grant to more fully organize and bring in law enforcement and treatment and prevention and people, at all different sides of the opioid problem. And then they gave us, a modest grant to actually get the syringe service started. And I don't think we would have been successful if we hadn't just kept plugging away at it. So I just want to encourage you that it doesn't happen overnight. What you really believe in, what you care about, what you think is important for health, what you want to see get done. And you should, try not to get too discouraged. Find friends and allies who can keep your spirits up so that when one of you is down, another one of you is up, and it balances out. But that's one of many stories I could tell you about advocacy and resilience, but I think that one's a good example.
Thanks so much, Dr. Feinberg. And Dr. Otten, do you want to just briefly say hi and give us a comment on the topic?
Sure. Yeah, I'll talk just a real quick story on resilience and resistance, if you will. So I think, getting through medical school, all of us are resilient, right? Having been through burnout personally and coming back from it, that's another form of resiliency, I would say. That was tested at a meeting about logistics when I was essentially instructed that I was going to go back to the town where I'd gotten burned out. Interestingly enough, I walked into the meeting with this coffee cup while I was in the process of co-authoring a book with a patient. And I was asked if it was a warning. And I responded with, "Oh, I guess it depends on how this meeting goes." And that meeting really actually started my advocacy journey because their inability to see me as a human being and have feelings and emotions about my workplace and to just pick me up as a chess piece and move me back to an area with a lot of painful memories was inappropriate. And so there was resistance by me at that moment, to the point where I resigned the next morning. And I stood up for myself. I stood up for my colleagues who were being mistreated. And that's taken me on this amazing advocacy journey that I'm on now. So I thought that was a story that wove in a little bit of resilience and quite a bit of resistance, I suppose.
That's great. And so I think, yeah, thank you so much. And I think something that touches on both of your stories, which is a topic that we're really interested in for the conversation today, is the idea of moral injury, right? And moral injury is a term that was initially used about veterans of the Vietnam War, right? And the idea was that you know what's right and you are kept from doing it by the systems that you're a part of. And, I think that there are certainly reflections of that in your story, Dr. Otten. And of course, we've seen that very clearly as, at least for me, I've been, I'm out of medical school for 15 years. And the way we talked about opioids in medical school is very different from, what we know today. Uh, and I think, the HIV crisis and other infectious disease crises have really put, doctors in situations of moral injury. People started using that term really widely about medicine after the COVID pandemic. And, the idea is that you know what care that your patient needs, but you can't do it, or you're doing something that you think will be harmful, but you are obligated to do it. Um, and so I think that the first question I have is just about ways to deal with this moral injury that is unfortunately part of our practice now, and to bring in the resistance element. What are your thoughts about action as the antidote to moral injury? And whoever, does anyone want to start?
Well, I'll start first, sure. And I think I'll go, for those of you that don't know, nearing the finish line of a documentary called Suck It Up, Buttercup. And the title in and of itself, I think, speaks a little bit about moral injury, uh, not only to clinicians, but also to patients in terms of what's going on in our healthcare landscape right now. But I had the pleasure of interviewing many of my heroes, frankly, of which that's probably different stories for a different time. But one of whom, which was Wendy Dean, who I now consider to be a friend, and she defined it as betrayal by a legitimate authority of one's, causing one to transgress their deeply held moral beliefs. And as a clinician in a fee for service world, this was going on for me on a regular basis. Every year, January 1st, a bazillion prior authorizations land on my desk. It got to the point where I guess maybe I was a little passive aggressive, filling some of them out in crayon and putting smiley faces and things of that nature on there. But that would put a little smile to my face as I was creating my own little mini resistance to some of these prior authorizations. But ultimately, I guess where I'm going with this is one of the things in the documentary is, in terms of our calls to action, is unlearning learned helplessness. Your actions matter, your words matter, how you treat your colleagues matter, the things you decide to do in terms of self care matter. And those are all ways that we can push further upstream to combat this pervasive moral entry that exists across the nation. So hopefully I didn't digress too much.
No, that's great. And Dr. Feinberg, your thoughts?
Well, I think one of the ways, there's no question that one suffers moral injury all the time. First of all, as Todd says, fee for service medicine is kind of a bizarre concept. And the fact that we can't take care of everyone who needs taking care of seems antithetical to the oath I took. Um, and I think one of the ways to maintain your sanity and not just feel like you're tilting at windmills all the time is not to do it alone. So I think fellowship's really important. I think having allies, uh, and as I mentioned in my opening story about the syringe service project, I think having people stand by you and stand with you is, even if you don't make progress that day or that month or that year in whatever it is you're trying to accomplish, at least you're not alone. So, I really encourage you to find like-minded people or talk people that you think are basically humane, but maybe not fully enlightened, and, talk to them, and see if you can't convince them you know, to join you in what you're doing. But I think that's the best counterweight to the aloneness. Otherwise, you come home from a long day at the hospital, the emergency room, wherever it is you're working, and you're exhausted. And, it, I mean, I lived in Rockville, Maryland, but I worked in Baltimore at Hopkins. So I had an hour commute. Sometimes I would like cry the whole way home, you know? And the antidote to that is just not to feel like it's just you, because it isn't just you, right? Because there are a lot of really decent people who care, um, or they wouldn't have become physicians or nurse practitioners or PAs. I don't think docs have a lock on this, although we often think we do. Um, so that I think has helped a great deal.
Yeah, and I think that's great. I mean, one of the questions that I have, is about the the costs of action, right? I find that the trying to fight the moral injury sometimes can get you sucked deeper in, right? And more discouraged. And so how do you draw those boundaries? How do you know when, I think Dr. Otten, you talked about, leaving a position. Like, where's your boundary? When is enough? When do you have to make a change in what you're doing?
Well, I'm not suggesting everybody just resign the morning after a meeting that doesn't go so well. There's obviously ramifications to that. For me, I think it worked out and I was taken on a path I was intended to be on. But I want to go back a little bit in terms of what Judith was talking about in terms of connection. I've done a lot of reading in the last year or so on trauma and trauma recovery. And for those of us that went through medical education and were taught to stuff everything into a box for the better part of, X amount of decades, that is not a healthy way to go. And connection definitely mitigates trauma. And I think that's also how there are opportunities for small wins. And as Judith was talking about, I was thinking about an example that, and I may be dancing around this question a little bit, but I think it's an important story. So we had gotten a request from a large insurer that one of the quality measures was going to be based on a survey of how patients thought medication reconciliation went. And I'm like, wait a minute. Part of our compensation is going to be tied to someone who's describing their medication as the little blue pill and the red orange pill and how well we went through that. I'm like, this seems like a really bad idea and a dangerous slippery slope to bad behaviors. And so I pushed back in an email saying, I think this is a bad idea. Little did I know, dozens of my colleagues had written similar emails. And lo and behold, that quality measure was subsequently removed from the compensatory mechanism. That to me embodies advocacy and a small win based on the collective will of that group and without even knowing we were doing that. Imagine if we can start to do that at scale and get organizations to start to work together on different initiatives. I think that's we're going to see the real magic, in my opinion.
Yeah, well, I do. I totally agree that organization and power in numbers is key. And that's some of the things that are sometimes alienating, is you sort of feel like you're a voice in the wilderness. And then sometimes when you speak out and you see the people around you like, oh, it dawns on them that something is wrong, or that what you've done is appropriate, then it gives you the courage isn't the right word, but it gives you the support that you need to keep going. So I would tell you another story. So once when I was still at the University of Cincinnati, and I was on ID service, and they said, oh, a consult down in the emergency room. So rather than wait till they got to the floor, we just went down and saw this person. And while we were down there, so it's a level 1 trauma center. It's the major trauma center for a big swath of Ohio and northern Kentucky and southern Indiana. And it was jammed. And, there were people on gurneys in the hallways, like not just in the little curtained cubicles. And there was a guy on a gurney. He was not the person we were coming to see, by the way. It was a gentleman on the gurney, and a nurse who had her back to him, but was clearly within inches of him. And she said to her, someone else who was standing there, well, I don't know why we resuscitated him. I don't know why don't we just let these junkies die? And the guy was like there. And I was so appalled. So I said to this nurse, I took her by the arm gently, or maybe not so gently, and I moved her some feet down the hallway. And I said, that was not the right thing to say in front of this man who just came back from the dead. And you should really think about that. You should take that into consideration, that substance use disorder is a chronic relapsing brain disease, and that does not make this guy, what's the word? Undeserving of your empathy. And I said this quietly. I didn't shout. But I was feeling pretty exercised about it. And, other people in the situation afterwards said, wow. Yeah, that was really the right thing. That was wrong, what she did. And talking to her about it was the right thing to do. And it's moments like that where you feel like, yeah, right. You do have to stand up for your principles. And, sometimes you wind up modeling them. And that's important because there's people all around you, including trainees, right? Medical students, nursing students, pharmacy students, people who are not even out of the school part of their training, who can see that there are moral imperatives in what we do.
Mm-hmm.
There are. I mean, medicine is just full of every day is a moral imperative, right, Todd? Every day. So,
Oh my gosh. Yes, that's an amazing story, by the way. And I love the fact that took some action and said something. And you probably hopefully had a positive impact, not only on that nurse, but also your colleagues. And that's just incredible. And you're right. I think back, I'm in a direct primary care role now. And so the amount of quote unquote moral injury that I'm enduring is significantly different than when I was in the fee for service world. But I joke, or not joke, when I'm talking about sort of my whys behind why I'm doing what I'm doing now, and why I'm so vocal, and why I'm passionate, and all these other things. One, having gone through burnout. Two, four of my colleagues have died by suicide in my career, including two that were close to me. But the third reason, which I think echoes some of what you said, was, the frustration of patients were daily, if not more than half of my day at times. I was really just having to calm people down about the cost of their prescription medications, or their struggles with access, or, the list goes on and on. I'm preaching to the choir here a little bit, but that moral injury and those impediments to delivering the care that we knew they needed were at times devastating. And, to have your colleagues to talk to or reach out as a sounding board when you're frustrated, that is so important. And I say it all the time. When I went through school, it was shove everything in a box and just keep going, work harder, do more, do more, do more. Well, that's all well and good until it's not. And when it's not, it can create incredible problems, not only for you, but the layers of people that are around you. And so if you get nothing else out of this, obviously self care is critical, but looking out for your colleagues, talking, connecting, and collaborating, especially in today's environment, is so important to combating not only moral injury, but burnout and all the other things that we talk about.
Yeah. No, I totally agree. And I think it's also valuable to get support from people outside medicine, right? Um, I know my close friends, none of whom are doctors, are probably get really uh, bored from hearing me rant and rave about the failures of the healthcare system. But um, you know, it's support can come from so many different avenues in your life, and you should cultivate that. So you should cultivate that.
Well, and since we're talking about this, and I'll detour again here a little bit. So when, after I published the book Ripple of Change, you're trying to figure out like, okay, I stopped seeing patients a few months ago. Where am I going? Where am I taking this energy? And so I got on LinkedIn and I started connecting with my colleagues. And I have some amazing friends that are a result of that process. And it speaks to the support structure that is out there. And sometimes you have to go looking for it a little bit, but it does exist. Like, I think about all the amazing people who are really trying to move the needle in the healthcare space. It's incredible and it's uplifting. It fills up my cup on a regular basis. And then I come to meetings like this where, um, I was joking earlier about the gray hairs that I've developed on my chin and all these other things, and that we need the generations behind us, Judith, to carry on the work that's been done. And not only that, but to take it to the next level. Um, so yeah, I'm just excited. Sorry, sometimes I just get on a roll.
I, no, for sure. For sure. I'm actually delighted. I hope there are many young physicians and folks in training who are listening or will wind up hearing this and feel not alone and inspired. So, this is actually, I mean, I think on some level, I would just share with you all that I came to this sort of prepared because I really kind of had quite a left wing background to begin with. It's not like I went to medical school and all of a sudden decided there was injustice in the universe. I kind of went to medical school because there was injustice in the universe. And uh, so that has really, of course, definitely colored the way I see the universe. Um, in high school, I had my closest friend. Her mother had been uh, a real primetime lefty in the 30s and 40s, and this was like the late 50s and early 60s. I know it sounds like centuries ago. It was centuries ago, and we and I grew up in New York, in and around New York City, and we would go like picket at the UN for nuclear disarmament. And, we would sing songs like Strontium 90 will get you even underground. And we went and picketed at Woolworths, even though the lunch counters were integrated in the North, they weren't integrated in the South. And so, you picket Woolworths in Hempstead, Long Island, New York, you know, it's an integrated place, but the organization is not. And so by the time I got to medical school, I'd been something of a rabble rouser for a while. And the Vietnam War was a big thing when I was just finishing college, and I actually went to graduate school in Russian history. So while I was working on this PhD, I was a member of Students for a Democratic Society, otherwise known as SDS, which was an old lefty organization. And then a small group of people broke off and created the Weather Underground. But that seemed crazy to me. I didn't think that like carrying guns around was going to fix things. And I said, I'm not doing that. I'm not going down that path. But I had friends who did. So I just want to be honest and say it's not like I discovered advocacy as a physician. I kind of been this sort of person for a while, but medicine will beat that out of you, right, Todd? I mean, it's very forceful. It's very powerful. Um, there's a lot of pressure to conform.
Yeah.
Um, there's a lot of pressure not to rock the boat. Uh, you know, and the problems with our healthcare system are the problems of our society, right? They're not separate issues. And so you really do, even if you didn't start life as a rabble rouser, you will definitely have to put some energy into fighting back, because the system really doesn't want people who speak up and say, this is wrong and we shouldn't do this.
The system is on many levels very happy with the status quo, and there's a certain subset that is very happy with making lots of money on what is going on, for sure. When I think about advocacy, Judith, I think of it on many, many levels, and it doesn't have to be um, maybe some of the things you did back in your younger years, and it doesn't have to be some of the things that I've done in terms of, telling a toxic system to take my job and shove it, as I allude back to an earlier story, or, writing a book or all these other things. There's lots of ways. I often talk about time, talent, and treasure, right? And I think about some of my colleagues who are afraid to speak up for fear of losing their job and the golden handcuffs and their debt load and all those kinds of things. And so some of their advocacy has come through in terms of supporting financially different projects or organizations, etc. So there's time, talent, treasure, right? Many ways to do it, to be part of positive change. And sometimes it's just being supportive for those who are the voice and standing beside them or behind them or whatever the case may be, and giving them a positive word when they're feeling down or had a bad day or they lost a patient, right? I mean, at times in these interviews, I tear up thinking about some of the things that I've endured in my career. And when somebody says, "Hey, Todd, you want to talk about it?" I mean, that's a mini form of advocacy from them to me, right? So there's just lots of ways to do it. It doesn't have to be these big, audacious things that we see. It can be the small. Again, we come back to the small wins, right? It could be a small win personally, because small win in a group. Um, yeah. So I agree. There's just so many examples of this now, and I think we're seeing more and more and more of it, which inspires and encourages me to keep going and keep being mouthy, which I suppose I've gotten good at over the years, in one capacity or another.
I would think for you both mentioned like these like newer and younger doctors who are listening right now. And, I know Dr. Feinberg, you talked about some very turbulent times. I would say right now is on par or even more so, right now is the time. And so, what would you say to those doctors who are not in positions of power, who are embedded kind of deep at the bottom rungs of these systems, but who are suffering watching what's happening to healthcare in our country? Like, what's their first step?
So I really would reiterate what Todd just said. And when he was talking, it reminded me this famous harm reductionist uh, named Dan Big, who really worked on like, uh, dealing with overdose in the streets of Chicago and people who had substance use disorder in Chicago for many years. And his famous phrase for this was any positive change. So it doesn't have to be a big thing, as Todd said. It could be a little thing. But everything that you think or say or do or support kind of moves the needle along. So even if you're not in a position where you can go out and, march in the streets or do whatever it is that you can do is a force for good. And you have to think of it in those terms, any positive change, just moving the needle a little is, and Dan Big was really inspirational to just, an enormous number of people with substance use disorder in Chicago, but really was the start of an entire movement that is, is really visible these days in terms of creating understanding and empathy for people and support. Right? I try to explain to people who get hung up about this. Nobody who's 16 years old, when you say to them, gee, what would you like to, what do you want to be when you grow up? No one says, I want to be addicted. Nobody says that because it's not a goal. And the fact that people wind up addicted is complex. But, it's when people start talking about how this is a choice and these are bad people, these are morally damaged people, I can't begin to tell you how much that really just bugs me because nobody does that, right? No, that's not anybody's goal in life. Gee, I think I'll spend the rest of my life with a needle in my arm. That sounds really groovy. No, that's not a thing, folks. So, any positive change, any movement in the right direction is something eventually that if enough of us do that, it will make a difference. I will tell you that I have spent I had foreboding before January 20th, but I will tell you I have spent every minute since January 20th just angry and sorrowful about the destruction of public health in this country and the destruction of research and the destruction of public health, not only in this country, but, all the people who are now dying in other places because we're not sending HIV medicines to Africa and Asia anymore. And I think, this is an evil we really have to oppose because, if you have the means to save people's lives, you should do it. That's what medicine's all about, actually, right? Shouldn't just be letting people die. That's just like what that nurse said. Well, we should just let them die. No, we shouldn't let people die. We should do what we can to help people not die and to, live healthy and productive lives. So I think, I think it just, we need a lot of us. I want everyone listening I want to pull you in. We need a lot of people. And there's all kinds of organizations that you can be part of at so many levels, even if you just send them $1 in the mail. But there's Defend Public Health, there's Stand Up for Science, there's so much going on right now. There's Grandparents for Vaccines. There's so much going on where people are trying to salvage what we had. And what we had was not perfect, but it's surely better than what it's turning into. So
Well, and I'd like to continue on this theme of what advice can we impart to the next generation. I think one of the things that I've been talking about quite a bit when I've been speaking to the up and coming physicians or medical students or college students is the concept of mentorship. And when you're in the position where you don't feel like you have the power, if you've reached out to someone that's a little further along in their career or in a different position, they may not have the answer for you necessarily, but they might know someone who does, or have a colleague or a path that might help you avoid pitfalls and all those kinds of things. I think back to, my career, and, I certainly had great mentors along the way, but I wish there were times I had taken better advantage of those things, and particularly when I struggled through burnout. I think had I had a mentor that possibly wouldn't have gone as far down that path as it had. So I would encourage the younger generation to search out mentors, and you might be surprised who will say yes to taking your phone call or having a conversation with you or this, that, and the other thing. I will tell you this, at this stage of my career, I've gotten to meet, as I said, some of my heroes. I never in a million years thought I would be in Don Berwick's backyard interviewing him for a documentary. I never thought in a million years I would be interviewing Mark Cuban for the documentary. And I think some of that was paying attention along the way. Some of that was some good mentors that I had, and some of it was probably just dumb luck. Um, but find some mentors, at least one that will help you through your journey. I can't stress that enough.
I agree. I totally agree. I think that, it's great to have encouragement from someone who's ahead of you in the scheme of things.
And I think we've got about 5 minutes. So, Dr. Feinberg, you talked about getting back what we had. But, a lot of the work I do is in public health disasters, right? And so we look at disasters as a policy window, right? As a way to maybe, the good things are broken down, but maybe the bad things are broken down too. So, if we all get together, if we all form a collective, tell us a little bit about the world that you would like to see come out of the current situation.
Oh,
In 5 minutes.
well, if I were going to speak in completely uh, idealistic language, I would like to see us provide health care for everybody in this country. Uh, um, you know, I'm appalled that this is the richest country in the world and we don't take care of everybody. Um, so that's a start. And I know, there's so many forces that say, oh, it can't be done. It can't be. But, I don't know. They do it in lots of other countries um, who also have high standards of living. And, I think it's a matter of determination and willingness. So I would like to see that happen. Um, then the other things, I mean, if if I really were thinking in grandiose terms, of course, health doesn't exist in a vacuum, right? There are the social determinants of health. And the social determinants of health are what? Poverty, you know, i- p- not having access to education, not having access to care, if we could actually fix that part, then, I think the health of people in this country would be a lot better than it is, right? If people didn't have to struggle so much. If I were thinking in more granular terms, boy, I would hope that we would recover vaccination from the incredible damage that's been done to it. So I'll tell you a very quick story. We did a study a couple of years ago. The CDC did a study with Quest, one of the big commercial labs. They looked at, this was some years ago, maybe 10 now, looked at women of childbearing age in Kentucky and looked at who had hepatitis C. And so we went to Quest and we said, you know what, we're interested in hepatitis B too. And we looked not just at Kentucky, but across the country. And interestingly, I will tell you that West Virginia, despite its many other issues, is one of 5 states in this country that had the most unassailable vaccine regulations. Like in West Virginia, you can't say, oh, I'm philosophically opposed to vaccination or my religion doesn't approve of vaccination. You can't do that. Your kid goes to school, they get vaccinated. And so when we did this study, every single woman of childbearing age, that's 15 to 44 is the typical way of thinking about that. Every single woman born after 1992 there's not a single hepatitis B test. Why? Because we started doing the birth dose vaccination at the end of 1991. And West Virginia is a poor, poor state and very rural and not easy to get health care, right? But the fact that everyone had to get vaccinated saved, right, an entire several generations born since 1991 of getting hepatitis B. Hepatitis B is a very bad disease, causes liver cancer and cirrhosis of the liver. People die from it. So I would like to, so now if we go back from the complete Pollyanna future and just think about more granular things, I would like to see us make sure that vaccines don't get continue to be disastered. I would like to have USAID handing out medicine for HIV all over the resource-constrained world again. I would like to see us work once again about eliminating all of these vaccine-preventable diseases, right? The only vaccine I ever got was smallpox, and it's gone now. We don't even vaccinate people for smallpox anymore. Disappeared.
Unless you're in the service, Judith.
Yeah. Oh, no. Well, I don't think the service would have wanted me, Todd, but
You might not have wanted me, Judith.
but there's all of these things that really save lives and preserve health that this administration has undone. And then if you want to get really granular, I would get rid of all of these fake people. There's all of these totally unqualified political hacks now running everything in this country, like the guy who runs the Pentagon, what's his name, with the hairdo, Hegseth. But there are all of his parallels in the health system. And I would replace those people with, people of probity and, people who have moral fiber and people who really want to see the health of Americans get better, not not get rich because they're selling fake cures on the internet like this Casey Means, who they're trying to make the Surgeon General. There's a woman who didn't even finish her training and doesn't have a license as a physician today, but she's going to be the Surgeon General of America? I don't know. Doesn't seem right to me. So there's some of what I would do. It's just a small list.
I'll give a shorter list. In the context, so watching the clock a little bit for the group here. I would like to see high quality primary care for every single American, which echoes a lot of what Judith just said. On a more granular short term window, I'll give another thing I would like to see. And I consider her a friend now. I would like to see Tina Shaw win her race in New Jersey. I believe a former DFA member who's running for Congress. So I would like to see that. She also is highlighted in the documentary. As I said, it's top of mind. So a lot of my stories come from the documentary, but those are two things, one long term and one short term.
All right, great. And I think we're right at time. So Hunter, would you like to close us out? And thank you both of you for your great and honest answers. This was a great conversation.
Thank you for having us.
Yeah, it's a pleasure. A lot of fun.
Yeah, thank you so much. I've thoroughly enjoyed the session. Um, I would like to thank you all for such a thought-provoking discussion. We are very grateful to have you and have your time, especially Dr. Feinberg, after an 18-hour journey today. Um, Before you leave, of a couple quick reminders, education is so important, and so is action. Action night sessions. Please consider sharing what you learned with your friends and colleagues and inviting others to join. Doctors for America
Please watch for additional opportunities to provide input on future policy issues and those of you that are paid sustaining members of Doctors for America can complete the survey for a 1 credit hour of CME attending this session. In addition, if you enjoyed the Advocacy Brand Round session, please consider supporting DFA's work and impact with a financial gift. The link to donate will be put in the chat. Thank you for being here and for all you do on behalf of your patients. We hope you will become official DFA member today and take a look at the benefits of memberships on DFA's website. The number one reason doctors and medical students and health advocates join DFA is to be with like-minded people that share the same values and priorities, which I think was highlighted today during our discussion about how community can make us so much stronger and resilient as we all work to provide the care that we so wish everyone had access to. Please remember to follow us on Twitter, LinkedIn, and Facebook to stay up to date with all DFA programs, events, and ways to get engaged. Thank you for attending.